I'm happy to be here and present our findings on the early effect of COVID-19 on workers' compensation. With this research, we ask essential questions for understanding the impact of COVID-19 pandemic on workers' compensation. For COVID-19 claims, we ask how does the prevalence of COVID-19 claims compare across states for the first 2 quarters of 2020. We also discuss variation that we see across states. For non-COVID-19 claims, we ask how did the number of workers' compensation claims change in the first quarters of the pandemic? We also examine the share of lost time claims and see if there are any changes. Finally, we look at the time from injury to treatment and evaluate whether that was impacted. For the scope of our study, we include 27 states. Um, we focus on claims with payments for either medical or income benefits for claims with injuries in these first 2 quarters of 2019 or 2020. So that we do not include claims with reserves only or $0 claims. To identify COVID-19 claims, we rely on nature of injury codes for COVID-19 or cause of injury code for pandemic. So let's start by looking at our findings for COVID-19 claims. And here I'm showing you the percentage of COVID-19 claims out of all claims with injury dates in the second quarter of 2020. And immediately you see large variation across states in the prevalence of COVID-19 claims, ranging from 1% in South Carolina to 34% in New Jersey and 42% in Massachusetts. In the median state, 6% of all claims were COVID-19 claims. Next, if we limit our attention to lost time claims, um, since COVID-19 claims are more likely to be lost time claims, mainly because of quarantine, or at least partially for quarantine requirements, we see larger shares of them among lost time claims. And the median state, the percentage goes to 20% now, and from at the high end, New Jersey and Massachusetts, we see 58, 59% respectively. And once again, we do see large variation across state in the prevalence of COVID-19 claims. So at this time, you may be thinking why there is such substantial variation across states in the prevalence of COVID-19 claims. And over the next few slides, I will show you that the timing and severity of the pandemic is an important factor explaining this variation. Also, differences in compensability rules matter. It's also important to remember that we're looking at the shares of of COVID-19 claims out of all workers' compensation claims. And the states that were hit the hardest by the pandemic. So not only high volume of COVID-19 claims, but also substantial reductions in non-COVID-19 claims. So that for those states, we also have shrinking denominator here, and that amplifies the share of COVID-19 claims in these states. So this is something just to keep in mind when we see this wide variation across states. We also looked at the industry mix, and that proved to be only a small factor behind this variation. So here we're going back to percentage of COVID-19 claims out of all workers' compensation claims for the second quarter of 2020. And here, and I'm adding also information on the severity of pandemic as captured by COVID-19 death per million in general population. And clearly, one can see that prevalence of COVID-19 claims is associated with the spread of the virus at the time. And the states that were hit the hardest by the pandemic in the second quarter of 2020, such as Connecticut, New Jersey, and Massachusetts, also had some of the highest percentages of COVID-19 claims. On the other hand, states that saw a lower COVID-19 death numbers per million population also had some of the um, lowest numbers in the percentage of COVID-19 claims. So we do see association between severity of pandemic and the prevalence of COVID-19 claims. Next, again, I'm showing you again, looking at the percentage of COVID-19 claims out of all claims for second quarter of 2020. And here I'm highlighting states that um, implemented COVID-19 presumption law by the end of the second quarter of 2020. And they're shown here in yellow. And you can see that these states tend to have higher percentage of COVID-19 claims with some exception. Um, New Jersey and Massachusetts, they didn't have at the time COVID-19 presumption laws in place, and they had some of the highest percentages of COVID-19 claims out of all workers' compensation claims. So they had some other workers' compensation system features contributing to these high numbers. And for Massachusetts, that was pay without prejudice. That is commonly practiced in the state. New Jersey, on the other hand, it actually passed COVID-19 specific presumption law in September, but at this time, it had a more general presumption law that established workers' compensation coverage for public safety workers in the event of them contracting communicable disease during an epidemic. So for COVID-19 claims, we also examined industry composition of the COVID-19 claims. And for that, we classified all industries into 8 categories, into 8 groups, and looked at the COVID-19 claim distribution across these groups. And as you can see here, COVID-19 claims heavily concentrated in high-risk services. More than 60% of all COVID-19 claims were happening among employees of high-risk services, and followed by low-risk services, about another 20% of COVID-19 claims. So you can see that service industries have a majority of COVID-19 claims by the end of the second quarter of 2020. And because of the importance of service industries, we decided to look at closer at them and see where exactly COVID-19 claims were happening. And here I'm showing you that vast majority of them were happening, occurring among employees of assisted living facilities, hospitals, and physician offices. And here I'm showing you results for the first 2 quarters of 2020. Oops. Yes. So in other words, we see a large share of COVID-19 claims happening in the healthcare industry. And because of the importance of healthcare industry for the prevalence of COVID-19 claims in workers' compensation, we also computed percentage of COVID-19 claims out of all workers employed in healthcare industry. And as one would expect, we do see higher shares, higher percentages of COVID-19 claims among employees of healthcare industry than across all industries. And in the median state, it goes up to 34%. And in Massachusetts, it reaches as much as 75%. Another important observation from this chart is that the pattern of interstate variation is still there, and states that were hit hardest by the pandemic, such as Connecticut, New Jersey, and Massachusetts, also have the highest percentage of COVID-19 claims in the healthcare industry. So that's another another way to see that industry mix did not play a role in that, in the differences across states and the percentage of COVID-19 claims. So now let's shift our attention to non-COVID-19 claims. And here we're going to see the impact of the massive economic slowdown, stay-at-home policies, and switching to work from home on the volume of workers' compensation claims, non-COVID-19 workers' compensation claims. And in this slide, we're showing the change in the number of non-COVID-19 workers' compensation claims from the second quarter of 2019 to the second quarter of 2020. Um, as you can see, all states experienced claim reduction from 2019 to 2020. And the majority of states had at least 30% reduction in the volume of non-COVID-19 claims, and as much as 50% in Massachusetts. This slide also brings information on the employment changes for the same time period for each state, and that's captured by the red line here. As you can see, again, all states experienced sharp drops in the employment for the same time period. So that must be that likely to be an important factor behind decreases in workers' compensation claims. However, it's important to note that the employment reduction does not explain the full magnitude of reduction in the volume of workers' compensation claims. Another interesting observation for non-COVID-19 claims is that we found almost no change in the injury composition of non-COVID-19 claims when we compared injury distribution between 2020 and 2019 second quarter injuries. We also looked at the lost time claims, and we find that the share of lost time claims or claims with more than 7 days of lost time increased from the second quarter of 2019 to the second quarter of 2020. And there are at least two contributing factors to that. First, non-COVID-19 claims were more likely to have more than 7 days of lost time in 2020 than in 2019. And also COVID-19 claims were more likely to have more than 7 days of lost time than non-COVID-19 claims. So these two factors were shaping what we see, what we saw for the increasing share of lost time claims among workers' compensation claims. So far, we've seen that the COVID-19 pandemic impacted the volume of workers' compensation claims. Let's now see if there are any delays or any changes in the time from injury to treatment. And for this part of the presentation, I will focus on non-COVID-19 claims with paid medical services and claims with more than 7 days of lost time. And to discuss our findings for medical treatment patterns, we will take on two perspectives. First, more immediate, we will look at the more immediate impact of the pandemic. And for that, we will consider claims with injury dates in the first two quarters of 2020 and compare results for them to claims with injury dates in the first two quarters of 2019. And also, we will take a look at the impact of the pandemic on the existing claims. And for that, we will look at the claims with injury dates in the third and fourth quarters of 2019 and compare results for them to claims with injury dates in the third and fourth quarters of 2018. So here I'm showing you average number of days from injury to treatment um, for evaluation and management services, emergency room visits, PT services, and surgeries. And I will show, and here we're looking at the results for claims with injury dates in the first two quarters of 2020. That's shown in yellow bars, and we compare that to the injuries in first and second quarters of 2019. Overall, we can say that we don't see any evidence of delays in medical treatments for these service types. For the Q1 and Q2 injuries. For Q2 injuries, here we even see slight improvement in timing before the surgery, about 2 days reduction, and similar change for PT services. Overall, here you can see that duration before from injury to treatment is shorter for Q2 injuries than Q1 injuries here. And that's to a large degree can be explained by our data structure. For both Q1 and Q2 injuries, um, data is evaluated as of June 30, 2020 for 2020 claims and June 30, 2019 for 2019 claims. So our results for 2020 and 2019 are comparable, but for Q1 and Q2 injuries have different maturity. For Q1 injuries, we have at most 6 months of data available, and for Q2 injuries, we have at most 3 months of data available. And so that for Q1 injuries, we observe some of the services that took place later in the claim development, and that's reflected in the larger averages here. Here, again, we're looking at the average number of days from injury to treatment, but for existing claims with injury dates in third quarter and fourth quarter of 2019 and 2018. And again, we don't see any evidence of delays in treatment, and we observe slightly shorter duration before first injury for both cores. So far, we've seen no delays, no evidence of delays in medical treatment. And here we will see if percentage of claims with these medical services was impacted by the pandemic or not. So here we're looking at the percentage of claims among non-COVID-19 last time claims, again, for with evaluation and management services, emergency room services, PT services, and surgeries. And now for the first quarter of injuries, we do see slight decrease, about 3 percentage points decrease in the share of claims with surgeries, and about the same drop in the share of claims with PT services. When we look at the claims with injury dates in the second quarter of 2020, then we do see 4 percentage points decrease in the share of claims with emergency room services. So patients do seem to be waiting emergency rooms in the second quarter of 2020. Here we again, we're looking at the share of non-COVID-19 claims with these 4 types of services, but for existing claims. And The main message here would be that we see no difference in the share of claims with evaluation management, ER, and PT services. However, we see a small reduction in the share of claims with surgeries. So there are some delays in um, receiving surgeries for this existing claims. We also looked at the average number of visits for evaluation and management and PT services, and we find no evidence of change um, during pandemic. So let me summarize our findings. For COVID-19 claims, we find substantial variation in the prevalence of COVID-19 claims across states. We find that most of them occurred in the healthcare industry. For non-COVID-19 claims, we find large decreases in the volume of non-COVID-19 claims. We also see increase in the share of lost time claims from 2019 to 2020. And when we looked at the medical treatment patterns, we found no change in time to first treatment and no change in the number of visits. However, we found some small impact of the pandemic on percentage of claims with surgeries, ER, or emergency room visits, and PT. Thank you for your attention, and I'm looking forward for your questions.